Nobody wants a fourth wave. Nobody. Absolutely nobody. We want to get on with our lives.
A new study by Canada's COVID-19 Immunity Task Force reveals children and teens had higher rates of antibodies in their blood before the third wave, suggesting they were infected with COVID more than other age groups.
This was before vaccines were available to adolescents. And so they actually had the highest rate compared to over 60s. They were higher than over 60s, but they were not higher than the 20 to the 59-year-old age group, which was the age group that were out and about having to work in public-facing jobs.
The new study found that the number of Canadians who have antibodies to COVID-19 or some form of immunity before the third wave was at 3.6%. Surprisingly, seniors over 60 not living in long-term care homes weren't the ones with the most COVID infections. Our children were. Dr. Hankins says the summer break is a crucial time for parents to get their kids both jabs before they go back to school, and schools need to do this.
We also need to work on ventilation big time before we get into winter and closed spaces and more likelihood of transmission, not only of SARS-CoV-2, but of influenza and other respiratory viruses.
The study also shows that visible minorities had double the infection rate and half the vaccination rate.
So we need to figure out, how many of them were infected because they're in those public-facing jobs that meant that they were more exposed than everybody else. So on that side, and on the vaccine side, what are the barriers for them? Are they access issues, logistics issues?
Dr. Hankins believes the world more than ever needs Canada's leadership on health to stop the spread of the virus around the world.
There's a moment now when we can do everything we can to make sure that other populations around the world are getting access to vaccines. If we don't, the variant, and maybe it'll be worse than Delta, will come back this way.
In Montreal, Melina Giubilaro, City News.
In